So at the end of my lecture, I hope that the students of third year MBBS should be able to recognize the features of reversible cell injury, already discussed in the previous lecture, and how to define the necrosis, how we are going to differentiate between necrosis and apoptosis. Though the apoptosis will be discussed later on in the next lecture, and will be able to list all the morphological features of necrosis and can identify all the patterns of necrosis. So first we will discuss that how our cells respond to stress and injurious stimuli. Normally the cells of our body in a steady state that we call the homeostasis, that's a normal cell state, and so change in homeostasis due to any stress or due to any injurious stimuli or excess physiological or pathological stress may forces the cell to adopt a new steady state, as we all know, called adaptation. So too much or continuous stress which exceeds the cell's adaptive capacity may lead towards the cell injury, which may be a reversible or irreversible cell injury. So what is cell injury? So basically the cell injury is a sequence of events when cells have no adaptive response or the limits of adaptive capability are exceeded. And the cell injury may be, the first is reversible and the next is irreversible. So reversibility depends on the type of the severity and the duration of the injury. Basically, there are the two important features which I want to discuss, the two important features of the reversible cell injury. First is the cellular swelling and the second one is a fatty change. So cellular swelling basically is the result of the failure of the energy dependent ion pumps in the plasma membrane, and sometimes called the hydropic change or vacuolar degeneration. So the fatty change occurs due to hypoxic and toxic injury, and it appears as a lipid-filled vacuoles in the cytoplasm. And it is the fatty change principally seen in the cells which are involved in the fat metabolism. For example, the cells of the liver, hepatocytes, and myocardial cells. And the other features of the irreversible cell injury includes the plasma membrane blebbing, loss of microvilli, mitochondrial swelling, dilation of the endoplasmic reticulum, and intracytoplasmic myelin figures. So these are all the features, morphological features of reversible cell injury. Now come to the necrosis, which is today's topic. So necrosis is a series of changes in which cell death resulting from degenerative action of enzymes on lethally injured cell. And the morphological alteration or the features in necrosis is the breakdown of the plasma membrane. The breakdown of the plasma membrane due to the enzymes and the other proteins that escape through the membrane make their way to the bloodstream, where they can be measured in the serum. For example, in case of the MI, we can measure the cardiac enzymes. So these are the enzymes which escape through the membrane and comes into the bloodstream, and we can measure it in the serum. Now, what are the enzymes which are involved in the digestion of the cells? So the enzymes responsible for the digestion of the cells basically derived either from the lysosomes of the dying cells themselves or from the lysosomes of the leukocytes that are recruited as a part of the inflammatory reaction to the dead cells. So the necrotic cells shows the increased eosinophilia. The second point of the morphological changes in necrosis after the breakdown of the plasma membrane is the increased eosinophilia on hematoxylin and the eosin stain, and basically this increased eosinophilia is due to the loss of cytoplasmic RNA which binds to the blue dye, that is hematoxylin, and secondly due to the presence of denatured cytoplasmic protein which binds to the red dye eosin and give more bright pink color of the cytoplasm. So basically the eosinophilia means the bright pink dye that stains the cytoplasm. So this is the RNA which binds to the blue dye and the denatured cytoplasmic protein which binds to the red dye. When there is a loss of the cytoplasmic RNA which binds to the blue dye, so it gives more pink color of the cytoplasm. The third is the moth-eaten cytoplasm. Appearance of the moth-eaten cytoplasm is when enzymes digested the cytoplasmic organelles, the cytoplasm gives the vacuolated appearance called the moth-eaten, as moth damaged the clothes we can see in the in picture. So the cytoplasm gives the moth-eaten appearance. And the fourth change or the feature in necrosis is the presence of the myelin figures. This is a world phospholipid masses called the myelin figures, and these derive from the damaged cell membrane. And these myelin figures or the phospholipid masses ultimately phagocytosed by the other cells or degraded into the fatty acids, and calcification of these fatty acids causes the formation of calcium source. Therefore, in the end, the dead cells become calcified. So these are all the morphological changes in case of necrosis, that is the breakdown of the plasma membrane, increased eosinophilia, moth-eaten cytoplasm, and the myelin figures. So this is the video that how the cell loses the functional control in case of a necrosis. We can see that the organelles of the cell become swollen and the chromatin clumping, and the cells have ultimately going to be burst, and all the organelles and come out, and the disintegration of the cell membrane. Now come to the nuclear changes occurs in necrosis, and the nuclear changes occurs in one of the three pattern, and it is all due to the breakdown of the DNA and chromatin. The first is the karyolysis. Karyolysis means the fading of the basophilia of the chromatin due to the loss of the DNA because of the enzymatic degradation by the endonucleases. There is enzymatic degradation by the endonucleases, so it causes the fading of the basophilia of the chromatin, that is the blue color of the chromatin. Now the next is the pycnosis. Pycnosis means there's a nuclear shrinkage and increased basophilia. Also seen, the pycnosis can also be seen in case of the apoptosis, and in this the chromatin condenses into solid or shrunken basophilic masses. The third is the karyorrhexis. In this the pycnotic nucleus undergoes fragmentation, and in the end the nucleus in the necrotic cell totally disappears. So this is a diagrammatic presentation of the nuclear changes in necrosis, and this is a picture of the karyolysis in which the nuclear fading. We can see the nuclear fading due to the chromatin dissolution, action of the DNases and the RNases, and This is the karyorexis, that is the nuclear fragmentation. The pycnotic nuclei membrane ruptures and the nucleus undergo fragmentation. And this is the picture of pycnosis, that is the nuclear shrinkage. The DNA condenses into a shrunken basophilic mass. So this is all the nuclear changes in the neck. Now this first picture on the left hand side shows the normal epithelial cells. Is the normal epithelial cells, and while the second picture shows the surface blebs, increased eosinophilia of the cytoplasm, and the swelling of the cells due to the ischemic injury. So in this picture we can see the blebs, we can see the eosinophilia, and we can see the swelling of the cells due to the injury, and these all changes are reversible. Now proceed to the third picture. On the right hand side shows the irreversible changes. And what are the irreversible changes? There is the loss of nuclei. We can see over here that the loss of nuclei, fragmentation of the cells, and the leakage of the contents. So we can see these morphological changes, reversible changes and the irreversible changes. Now this is a diagrammatic presentation of the morphological changes in a cell injury, and we can compare the morphological changes in necrosis and apoptosis. First we are going to revise the morphological changes in necrosis, as we already discussed. So the left hand side picture shows the changes in necrosis, that is swelling of the endoplasmic reticulum and the mitochondria, and the formation of the myelin figures, membrane blebs, breakdown of the plasma membrane, and organelles and nucleus, and leakage of the contents, and obviously there is a recruitment of the inflammatory cells and the nuclear changes. While the apoptosis is defined as the programmed cell death, in which the cell breaks up into fragments called the apoptotic bodies, which contains the portion of cytoplasm and the nucleus, and the plasma membrane remain intact. And the dead cell rapidly wipe out or destroy before the contents leaked out, and that's why the cell death in this manner does not elicit an inflammatory reaction like in necrosis. And this is a morphological changes in necrosis and in apoptosis. Okay. There is a presence of the inflammatory cells, while in apoptosis there is no inflammation, and in apoptosis the apoptotic bodies are phagocytosed by the phagocytes, and we can see there is a swelling of the endoplasmic reticulum and mitochondria, and the presence of the myelin figures, and blebbing of the plasma membrane, all this in necrosis. So these are all the features of necrosis and apoptosis. How we are going to differentiate between the necrosis and apoptosis. In necrosis, the cell size becomes enlarged due to swelling, while in apoptosis, the cell size becomes reduced due to shrinkage and the formation of the apoptotic bodies. In nucleus, the nuclear changes include the pycnosis, karyorexis, and the karyolysis, while in case of apoptosis, there's a fragmentation into nucleosome-sized fragments. The plasma membrane is disrupted in necrosis. The plasma membrane ruptured, while in apoptosis, the plasma membrane is intact, And the cellular contents, there is an enzymatic digestion of the cellular contents, or the cellular contents may leak out of the cell due to the rupture of the plasma membrane, while in apoptosis the plasma membrane is intact and all the cellular contents may be intact or may be released in apoptotic bodies. There is an inflammatory response in case of the necrosis, but in apoptosis there is no inflammatory response. The necrosis is always due to the pathological condition and is an irreversible cell injury, but in case of necrosis it may be a physiological or it may be a pathological. There's a physiological apoptosis in case of the embryogenesis, and the apoptosis will be discussed later in the lecture. So today we focused on the necrosis. So what are the types of the necrosis? What are the patterns of the tissue necrosis? So there are 6 patterns of necrosis, including coagulative, liquefactive, gangrenous, caseous, fat, and fibrinoid necrosis. First, we discuss the coagulative necrosis. It is a form of tissue necrosis in which the component cells are dead, but the basic tissue architecture is preserved for at least several days, and it is characteristic of infarcts, that is areas of ischemic necrosis in all solid organs but except the brain. So picture on the left side shows a wedge shape kidney infarct, which is yellow in color, with preservation of the outlines, and the picture on the right side shows necrotic cells of the kidney. These are all the necrotic cells of the kidney. An infarct in the upper portion of the picture, showing the preserved cellular outline with the loss of nuclei and the presence of the inflammatory infiltrate, as compared to the lower portion. As compared to the lower portion of the same picture, which shows the normal kidney epithelial cells. So the upper portion shows the necrotic cells of the kidney, and the lower portion shows the normal epithelial cells of the kidney. So in upper portion we see that there's a preserved cellular outline and the presence of the inflammatory cells. Now comes to the liquefactive necrosis. Liquefactive necrosis, in this the picture shows the infarct in the brain, showing the dissolution of tissues, and this type of necrosis is characteristic of the hypoxic death of the cells within the central nervous system, and seen in focal, bacterial, or occasionally fungal infections, because microbes stimulates the accumulation of the inflammatory cells, and the enzymes of the leukocytes digest or liquefy the tissue. And again, this necrosis is characteristic of the hypoxic death of the cells within the central nervous system. And the necrotic material is creamy yellow because of the presence of dead leukocytes, and is called the pus. And the areas undergoing necrosis are transformed into a semi-solid consistency or state. We can call the liquid viscous mass, for example, the abscess. So we can find the liquefactive necrosis in the central nervous system. And now comes to the caseous necrosis. The term caseous means the cheese-like in appearance, and it is derived from the friable white appearance of the area of the necrosis, as we can see in this picture. And this necrotic area contains the collection of fragmented or lysed cells and the granular debris enclosed within a distinctive inflammatory border. This is a characteristic of focus of inflammation, which is known as granuloma, which we'll discuss in detail in the chapter of the inflammation. So the caseous necrosis found in a tuberculous infection in lungs and characterized by a cheesy yellow-white appearance of the area of necrosis. And this picture shows the large area of caseous necrosis containing yellow, white and the cheesy debris due to the tuberculosis of the lung. Another one is a fat necrosis. Fat necrosis is a focal area of destruction, of fat destruction, typically resulting from the release of activated pancreatic lipases into the substance of the pancreas as well as the peritoneal cavity, and it occurs in acute pancreatitis, and the derived fatty acids then combine with the calcium to produce visibly chalky white areas, that is the fat saponification. We can call it fat saponification, and these fatty white areas we can see here in this picture. This is the fatty white areas, and the picture shows the white chalky deposits, that is the fat necrosis in the mesentery. This is the mesentery, and we can see these white chalky areas of fat saponification. Now the next one is the fibrinoid necrosis. It is usually seen in immune reactions involving blood vessels, and in fibrinoid necrosis, complexes of the antigen and antibodies are deposited in the wall of the arteries, and after depositing in the wall of the arteries, these complexes combine with the fibrin, which is derived from the vessels, and gives the bright pink appearance on hematoxylin and eosin stains, and called fibrinoid, that is fibrin-like. So the picture shows the wall of the artery and showing a circumferential bright pink area of necrosis with inflammatory cells. And this type of necrosis, that is fibrinoid necrosis, can found in immunological tissue injury or immune complex vasculitis, autoimmune diseases, Arthus reaction, or arterioles in hypertension. Now the next is gangrenous necrosis. So this type of gangrene most often seen in on extremities, usually due to trauma or physical injury. We can use the term dry gangrene when there is no bacterial superinfection and the tissue appears dry, and wet gangrene when bacterial superinfection has occurred and tissue looks wet and liquefactive. So these are all the pattern of the tissue necrosis. Now I'm going to conclude my lecture. So first we discussed the necrosis. We should know the definition of necrosis, that it is a series of changes in which cell death resulting from degradative action of enzymes on lethally injured cells. Now then we should know the morphological changes in necrosis, which I discussed in detail. That is the breakdown of the plasma membrane and increased eosinophilia and moth-eaten cytoplasm, presence of the myelin figure, and the nuclear changes include pygnosis, karyorexis, and the karyolysis. And the last, we should know the pattern of necrosis. So basically, the pattern of necrosis includes the coagulative, liquefactive, and caseous necrosis, fat necrosis, fibrinoid necrosis, and gangrenous necrosis. Thank you so